Cornerstone.
Yes,
Okay.
that's your mental health
Mhm.
hospital here in the County of Union.
Yes.
I dressed this way because I wanted everyone to be able to see what it's like. This is how we work through COVID.
Excuse me, you have to address us,
Oh,
but
I'm
also
so
please
sorry. I apologize.
give your name and town of
Yes.
residence for our record.
Yes, I'm sorry. My name is Wendy Estevez. I'm the president of HBA Union at Cornerstone 5112. And thank you very much for allowing us to come in to speak to all of you, commissioners. Thank you very much. Thank you, public. But we just wanted to show you what it's like to work every day with COVID patients dressed in this attire. I think it's hard for people to envision it until you actually see it in person. We usually have gloves wrapped in duct tape as well. But that's enough of that. Just as, I'm going to take the mask if you don't mind so you can hear me. Thank you. Again, like I said, my name is Wendy Estevez. I'm here to represent the RNs at Cornerstone Behavioral Health Hospital. We have all endured much during this 3-year pandemic. Nurses are built for endurance for sure, but this has been like no other time in history. Just driving to and from work was surreal. Your mind focusing not only on the task ahead, but remembering you could be the vector that brings COVID to your patients or the reverse, back to your home and your family. I'm sure all of you have had these same kind of thoughts or perhaps fears. We as nurses were first on the line to come for our patients, either for their mental illness, for their COVID positive status, for their COVID negative positive status. It went back and forth many times. We were dressed like this, we were undressed, we were dressed again. So while doing this, we were covered head to toe in the PPE. Sometimes there was not enough or even substandard, which was very frightening when we discovered that we had non-medical masks that we were wearing. But we did the job, donning off and donning on between rooms. We were no longer just giving medication, having one-on-one interactions regarding patients' thoughts and feelings. We were educating patients in real time about the true dangers we were all facing together. And doing this while being short-staffed due to our coworkers' illnesses and recoveries. We have continued to lose staff during the pandemic. 7+ RNs have left and have only been replaced with 1 full-time RN and 3 part-time RNs. Please help us to rectify this shortage by filling positions, opening up, adding more staff. There's staff available that want to work. They've been coming back and forth to HR for months. They haven't been approved for the jobs yet, and we don't know what the holdup is. If someone could please look into that and help us out with that, we would really be appreciative. We became family members to all of our patients as they were kept from their own families. While handling our nursing duties, we were also required to wear the hats of dietary, running back and forth for trays, calling, trying to get anybody who was in the kitchen. Many times the phone just rang and rang and rang, and you had to send somebody. But the patients were asking for their food. Mentally ill patients are different than any other patient. Those little things can cause them to, become very upset, very angry, become agitated. So those are things that we were trying to keep a cap on. Also, we were working as housekeeping. Many times they couldn't provide housekeeping for us. And you're working in COVID, so you're washing everything down yourselves. You're washing patient bathrooms. You're washing your own bathroom that you can use. You're washing bedrooms. You had to do it. There was no choice. Other people weren't there available to help us. We became maintenance, calling them. The ceilings were falling down because it was raining. There was pieces of floor, ceiling on the floor. It was crazy. We had to be the unit clerks. We answered the phones. We stamped the charts. We filled the charts. It was a little bit overwhelming. We were the social workers, because they were at home. They were able to work remotely. There was many different people that were allowed to work remotely, but the nurses were there. And when I looked to my left or I looked to my right, I didn't see my administrators helping us, which was very sad. We were there together, just the nurses and the IAs. We were truly here for the long haul. We have been your essential workers, but not treated as such by the county. We received no compensation, only sandwiches. So we're here today to ask for a fair contract amid an inflation rate of 9.1%. We expect to be compensated fairly. Please take this into your deep consideration. Thank you for your time and your attention, commissioners and public.
Thank you, Nurse Estevez, and thank you all for your hard work during such a difficult time. I know it's ongoing. However, we cannot obviously comment on contract negotiations, but I do thank you so much for your comments. The floor is still open if there are any other comments. Please. Please give us your name and town of residence for our records.
My name is Valerie Hamer. I live in Plainfield. I'm the grievance chair for HPAE 5112. I've been working at Cornerstone from 2016. I have been a nurse for 18 years. I've worked in many hospitals. At Cornerstone, I had to work alone during COVID. The unit had 23 patients. 15 of them were considered marked for unpredictable behavior, and as well as having COVID. On these occasions, I had to adhere to strict COVID isolation. During this occasion, patients were threatening staff, chasing staff, refusing to follow direction. I had to call the doctor 3 times. I had to write the order, transcribe the order, and carry out the order. During this time, I also, as a family, it was very stressful. I have an immunosuppressive family member at home. So my concern was not only for me, but for my patients, but also for my family member. And the reason why I was concerned, because we did not have appropriate equipment at that time. Therefore, the disease could have been contracted at any time by me and carried on to my family member, who was told if they contracted the disease, they would die. But during all this stressful time, we continued coming. I came to work for 2 years straight without calling out. The administrators, the head of or the department's head, they were not available at the time in the unit when I was there. Madam Commissioner, Commissioners, all we're asking is for a fair contract for the nurses. We were there for the patients, and we're still there. So we need your help in getting a fair contract for the work that we have put in to keep our patients safe. And I'll paraphrase, I feel as the Massachusetts representative Ayanna Presley said. She said, we are due a fair contract. She said, we should survive, we should thrive. We should not have to thrive in our work environment, but we should survive. How can we survive without appropriate equipment and not getting fair wages today? So I hope you take this into consideration, all that the nurses have done and continue doing for our patients. Thank you.
Thank you so much. The floor is still open.
Hi, good evening. My name is Elaine Blake, and I'm a registered nurse at Cornerstone, and I'm also the Secretary-Treasurer for HBAE.
And the town you're from?
County I'm living, or the county where is that?
The city, the municipality you live in.
Union County. Berkeley Heights.
Oh, Berkeley Heights. Okay.
Berkeley Heights,
Gotcha.
Cornerstone. Okay. I am working at Cornerstone, otherwise known as Ronald's, for 18 long years. I came here today to inform you about some of the concerns that we have. We had staffing problem last year, and we still have staffing problem. During the height of COVID, we wear cloth gowns that we were forced to take home to wash. We had to keep the patient calm because they have no activities to keep them going, so we had to engage them. They were forced to stay in their rooms, and that put a burden on the staff to keep them in control. Some of you may say, that's what you signed up for. For us, we say yes, we agree, but we just know that we at Cornerstone matters, and we just don't want to be considered as the forgotten ones. I know many of you remember Ronald's, old Ronald's, but some of you may not know about Cornerstone. We still exist. Thank you very much.
Thank you so much, Ms. Blank. The floor is still open.